Okay, it's showtime. Hello, it's Bill Paravano, the knee pain guru. Welcome to Friday, June 5th. It's been an exciting week, to say the least. And today we're going to talk about an urgent strategy for knee pain treatment during protesting and coronavirus. Now, I do want to share with you a lot of times, and just with the uncertainty of what's going on in the world right now, at least in the U.S., that there is people end up getting knee pain for various reasons. So what I wanted to do today, it was go over just some strategies that you can use in the short term to get care for your knees. If in case you find yourself in a protest or you're in a shelter-in-place situation where you can't get the help that you would like. So we're going to go over some different strategies today as far as that goes. If you have any comments or questions, please enter those in over in the live chat, and I'll address those after this short presentation. So we're going to go right now. We're going to go into an urgent strategy for knee pain treatment during protesting and coronavirus shelter-in-place situations as well. So it's important to really get clear about where you're at, like what has gone on that has led to the pain. Did you have knee pain? We're going to take the protesting situation. Did you have knee pain before you chose to go protest, or did the knee pain happen as a result of the protesting? Either the distance that you walked, or it was something happened where you fell and you hit your knee. Those are two different types of situations. A lot of these are hypothetical because when I work with clients, so we're addressing what's going on and try to eliminate as many of the unknowns as we possibly can. First and foremost, if you can go get a diagnosis, then go get a diagnosis. That is extremely helpful because, one, it clears up exactly what's going on in your knee, what you're dealing with. If something is fractured in the knee, if something is torn in the knee, be it a ligament or tendon or meniscus, that is extremely helpful to know exactly what you're dealing with. So getting a diagnosis first is important, crucial, as a matter of fact, if it's possible. RICE therapy as soon as possible. Rest, ice, compression, elevation. Any doctor, any physical therapist will tell you to move forward with that because that's what they would do. Now, in a protesting situation, 99 times out of 100, they're going to have some sort of medical tent or medical table there at the protest. Go find it. Ask where it's at, because at that table or tent, they're going to have some highly, highly trained medical professionals. You would be absolutely shocked at the quality of medical, those that volunteer, that are EMS, doctors, physical therapists, just a whole host of really, really high quality medical professionals that'll be at that medical tent or medical table at these organized events. When you're there, ask, their experience, who would be the best to talk to about what's going on with your knee, and then ask them to perform a Lachman's test. That's Lachman, Lachman test. That is to give an idea if the tendons and ligaments are intact in the knee. A lot of times, if you're in a situation where you can't afford medical support, can't go to a regular hospital or an emergency room or whatever it is, don't have a family doctor, you can get this Lachman's test at these medical tents or tables at these organized events. So it's something that's very useful and very valuable, and you can tap into the resources of the community in that area. I would also suggest that the person that you do work with, ask them for their contact information to see possibly if you can contact them after as a follow-up on what's going on with your knee. In that case, once you have, essentially you're getting a diagnosis from a medical professional, it's just not the typical environment that you would normally get. Then see what they say. What is their protocol that they would give you in that situation? So utilize that. You can be very effective in your helping yourself in that situation. So that would be the situation for the protesting. Of course, stay safe, be nice to people, and yeah. So there's that, the protesting situation. Now, with the coronavirus situation with the coronavirus, and that has happened a lot, where because of the shelter in place, because people haven't been going out a lot or not allowed to go out much, and the hospitals and things like that have stopped elective surgeries. They're only doing essential things because of the claims that they're going to be overwhelmed and all of those types of things. The strategy is going to be a little bit different, and especially there's layers of this that we need to understand. The getting a diagnosis is just as important. Was your knee hurting like this before this shelter-in-place order went in place, or did it happen afterwards? It's going to be two different situations. If it's something you know exactly what you're dealing with, you can have a situation where something is broken or torn, or nothing is broken or torn. And if something is broken or torn and you're looking for, or you're waiting for the elective surgeries to go back in place, it's a different situation or different scenario. And then we need to look at the degree of tear, what's going on in the knee, if in fact that's what's happening. So we need to evaluate what your situation is, what you're dealing with. The more information we can draw into the room, we can develop a strategy to get you out of pain. In certain situations where you have something broken or torn in the knee, or it's an unknown, the injury has happened since the shelter in place took place, and you're not unable to get to a doctor for whatever reason to get a diagnosis, we have to gather as much information as we can to develop an interim strategy to reduce the pain and increase your function as much as possible in the process. It's a different situation. It's a different scenario, very much than like an urgent situation where we need to really understand what's going on with the knee. So we're going to do a little bit of damage control for all intents and purposes until they start elective surgeries, the shelter-in-place orders are lifted, and you can get back and see your regular doctor or develop a strategy with that. And in that case, I can possibly help. I have some information over on my website, thekneepainguru.com, as far as developing a strategy. Now, granted, my approach isn't for everybody. There's people that are looking for, a pill, a shot, something like that, a quick fix. I may not be your person because I'm looking at taking someone that's really in pain and they've kind of jumped through all the hoops with the conventional medical model, and they're kind of at the end of the rope. The range of motion continues to decrease. The scar tissue continues to build up. The pain continues to increase, and their quality of life is going down over time. And those people that want to put in a little bit of time, energy, and effort around creating comfort in their knee, we can increase the range of motion, decrease the pain, break down the scar tissue, all that with a fraction of the time, energy, and effort that it would normally take to do so. So those are the two strategies. One for the protesting, if you find yourself in a situation where your knee hurts, as well as a situation with the coronavirus, the shelter-in-place orders. If you have comments or questions, please put those in the live chat. Make sure to give the video a thumbs up, like and subscribe to the channel, turn on notifications for future videos. I do these twice a week based on questions and comments that come in, as well as trending issues. I'm sure things will continue to be changing over the next several weeks. Okay, no questions or comments are coming in. This is Bill Paravano, the Knee Pain Guru. Thanking you so much for being here. Have a wonderful day. Stay safe out there. And we'll see you on next week's video.